think people will be rolling in. Hello, everyone. Thanks for coming. Again, I am Jalian, Director of Storytelling and Communications at Forward Through Ferguson. I'm here with Erricka, who's an amazing 911 dispatcher, Lauren Moyer, who is really active with the 988 and from Compass Health Network. And Brian Maydwell is here as well, off camera since he is on the road. And we will get started. It is a good time to get started, so I will do that. So thank you again for coming to the Transforming 911 Report Release webinar. Today we are sharing an overview of the Transforming 911 report, a preview of the recommendations, as well as a chance for question and answer. So look at the bottom of your screen where it says Q&A. There's two little speech bubbles. That is what you can click and you can ask your questions. And people can also upvote those. And Nicole, who is our Director of Community Partnerships, will be monitoring the Q&A and letting us know, hey, here's a question that can be answered. We can answer that live, or we can answer it in the chat, in the Q&A part. So just be patient with us as we figure out this technology. So this webinar is being recorded, and it will be transcribed for those who cannot attend today. Throughout the webinar, please ask questions again in the Q&A area at the bottom of your screen. Again, we will answer them live or answer them there in that part. So I want to also share with you my screen because that is where my presentation is. Ooh. Amazing. And I should probably also do the share computer sound. All right, so if you haven't checked out transforming911.org before, I highly recommend you check it out. That has our top findings. It has a letter from the co-chairs of the board. It also has ways to take action. And my favorite part, of course, is the stories. So transforming911.org/stories contains real stories of St. Louis residents about their experiences with 911, and it really brings home what's at stake for all of us. So starting off, Forward Through Ferguson, if you're not familiar, is an anti-racist systems change organization that was established as a 501c3 to be a catalyst for lasting positive change in the St. Louis region, as outlined in the Ferguson Commission report. So essentially, we are the nonprofit that emerged from the Ferguson Commission report, which had 189 calls to action to lead us towards racial equity. We are a 501c3, so any donations that you make to power our work, sustain our work, are tax deductible, and we continue to make sure that people who are accountable, whether they're people in power or groups or entities, that they are being held to account for making sure that we work towards the 189 calls to action as a region. We also make sure to bring people together. Sometimes there are smaller groups that might be working on their own on certain issues. We try to build coalitions, strengthen relationships, things like that, just so that we can all be working towards racial equity. So embracing the Commission's mandate, we're centering impacted communities and mobilizing accountable bodies to advance racially equitable systems and policies that ensure all people in the St. Louis region can thrive. So I'm really excited to announce that with the Transforming 911 full report, you can also see stories of everyday St. Louisans, as well as on transforming911.org. This is part of our work of centering impacted communities, so people who are directly impacted by racism and incarceration and the current 911 system and all of its shortcomings. Those are the people who get to say where we go from here. So what is Transforming 911? First of all, it's a community accountability and advocacy tool. Those are some really big words, and it's a kind of long way to say that essentially for anyone who wants to make change with the 911 system, who wants to reimagine public safety to center community and care, Transforming 911 is for you. We have data and research to inform your decision-making or inform your advocacy for policy, inform budgeting. We also have stories just to enliven that data and research and make sure to ground the things that we're talking about. We are also examining the 911 data, stories, and landscape. And so what that means is that a lot of people know what 911 is, but they're not necessarily understanding how 911 works. And that's actually, it is kind of a confusing process. And so when you look at transforming911.org or the full report, one of the things I'm really proud of is that there's a full page, an illustrated comic essentially of the path that the 911 call takes once you call 911 and a call taker takes it. What are those decisions that the call taker is making? How is it informed in terms of if you're put on hold or hung up on, why is that happening? So that's really fascinating to me. The other part of the landscape is that our 911 system is incredibly fragmented. That's because in the county alone, we have close to 90 municipalities, and we have around 53 police departments and 15 public safety access points. So a lot of the parts of the 911 landscape are disparate. So then the last part of transforming 911 is an action step. So we are calling you to join us in reimagining and transforming our public safety system. Currently, there's already a question. I'd love to know more about the firm we used for data analysis. That's a great question. Laura, we worked with Datalytics. They are a firm that has done 911 calls for service analysis before, and we're looking forward to working with them on analyzing city data. So most of the analysis that we're talking about today is from St. Louis County. So I want to give that caveat that this data is call for service data between 2015 and 2020. We all know that 2020 was a really strange year with the pandemic. The pandemic has not ever really left us. It has changed our region and our world forever. And yet there's a lot of things that we can learn from this data analysis that I hope we can take into transforming for the future. Great question, Laura. So I want to start with a video we produced in partnership with the Dream Creative and Story First. And this video provides an overview of why Forward Through Ferguson is transforming 911. And I'm really excited to announce this is the second Telly Award winning video that Forward Through Ferguson has produced with Story First. The first being for Still Unequal. When you go to stillunequal.org, you can check out our video that we produced with them about educational equity. So take a watch and listen. No. Is it just a screenshot? Why would I do this to myself? Hold on. Please dance to yourself or something. Now, when I play the video, it will probably have ads and stuff, and I don't want to show you all that. So I'm going to stop sharing for a second. If you all had a long day, take this moment to loosen your shoulders. Just relax yourself. Maybe breathe. If anyone knows what box breathing is, practice that. If you don't know what box breathing is, look it up on Google. All right, I did it. This webinar is also known as Jalian Figures Out Technology.
Imagine you've got an emergency. Maybe someone you love is having a mental health crisis. Maybe you see someone in distress on the highway. Maybe you hear a disturbance in your neighborhood. From a young age, we're taught to call 911. But do you really know what happens after that?
911, what's your emergency?
If you're calling from a cell phone, your call pings off the nearest cell towers and goes to the nearest 911 call center. In St. Louis, those call centers are housed in police departments. When a call taker answers, they'll ask where you are so they can confirm where to send help and make sure you're in their jurisdiction. But wait, why wouldn't you be in their jurisdiction if your call pinged the tower nearest to them? First off, because the current 911 system wasn't built for today's cell or Wi-Fi technology. But locally, it's also because the St. Louis region is super fragmented, with close to 90 municipalities. St. Louis County PD provides 911 services for about 40 of those municipalities. St. Anne PD covers another 12 or so. West Central Dispatch works with 8. A handful of municipalities have their own 911 service. You get the idea. This fragmentation means the call taker may need to hand you off, as crucial seconds or even minutes tick by. So you're finally talking to the right 911 call center. Now what? The call taker will ask questions about your emergency and translate their notes into codes to quickly tell the first responders what to expect when they arrive on the scene. And the questions can change based on the call center, call taker, and how each center trains its staff. And codes can differ from call center to call center too. If the call taker determines you need an ambulance or a firefighter, they have to route you to the fire department dispatcher. Since 911 call centers are housed in police departments, other first responder services are usually fielded through a separate system. Another thing that might slow response time is capacity. Local call takers and dispatchers tell us there aren't enough staff to answer 911 calls, and that their shifts can last up to 12 hours or more. The fragmentation, inconsistency, and strain help explain why 911 call response times can vary from almost immediate to, well, DoorDash might get there first. Now, what if the call involves a mental health crisis? Or you're calling about something suspicious, but nobody's in danger? For mental health emergencies, the call taker might call fire or EMS to respond, but usually they send a police officer who may or may not be fully trained to handle mental health crises. Too often, 911 calls result in an armed police officer being sent to the scene, regardless of what each individual caller needs. Is that the right response? Forward Through Ferguson partnered with Datalytics to analyze more than 1.7 million 911 calls made to St. Louis County Police from 2015 to 2020. Our research found that the vast majority of calls to 911 in St. Louis County are not for major crimes. Most of those calls don't need armed police to show up, but almost 100% of the time, that's the default response. So how has 911 become synonymous with police? Well, many people assume 911 was created simply as an emergency response system. But 911 as we know it didn't even exist until the late 60s. Civil rights movements were sweeping the country, and 911 was created to help suppress Black and brown uprisings against segregation and police brutality. But lately, as budgets for social services and safety net programs have shrunk, budgets for policing and incarceration have generally grown. This puts the burden on police to provide vital social services they're not trained or equipped for. In other words, our policy and budgeting decisions have created a 911 system that was designed not for care, but for control. And we've seen it used that way, particularly in predominantly white communities where folks use 911 as a customer service line and use it to call in the mere presence of a person of color they think doesn't belong in their neighborhood. Those calls often result in tragic interactions between people and police. There are too many examples where the arrival of an armed police officer ends in tragedy, trauma, and reinforced mistrust of our public safety system, particularly when those calls involve communities of color. So it's time for St. Louis to join national movements toward community-based safety responses. That's why Forward Through Ferguson is introducing Transforming 911, a community accountability and advocacy tool that examines St. Louis's 911 system and serves as a call to reimagine public safety. Because the 911 system we have isn't working for anyone. It's not working for call takers and dispatchers. It's not working for the police. It's not working for all the St. Louisans who have to use 911 to access our public safety system. But it doesn't have to be that way. People built this system, and that means we can build a better system that centers community and care. To learn more and get involved, visit transforming911.org.
So if I were giving this presentation in person, I would say take a deep breath in and take a deep breath out. And I'll still say it, even though we are here. So now I will make sure to share my screen for the presentation. Right. So what I have here is a timeline of transforming 911. One thing I want to emphasize is that transforming 911 didn't just come out of nowhere. Forward Through Ferguson staff didn't just sit around twiddling our thumbs and go, what should we focus on? 911. It really came from our conversations with community. So we talked to community residents of Ferguson, O'Fallon Park, and Dutchtown in these state of police reform forums, and that was part of our yearly State of St. Louis report. So if you look on forwardthroughferguson.org, we have various reports, and one of those is the State of St. Louis report, which tracks annual movement on the calls to action, the 189 calls to action named by the Ferguson Commission as ways for the region to move towards racial equity. And so in one particular year, we were talking about the state of policing essentially. And when we communicated with residents, we were realizing that they really wanted 911 response to be better. It was a top priority for them to have non-police first responder alternatives, essentially because a lot of people aren't necessarily comfortable calling 911 for a variety of reasons. And when you want help, when you're in crisis, you want to be able to have something that you can rely on. So in 2020, and that was the start of the pandemic, we hosted the Power Behind the Badge series. We went through the structure of policing in St. Louis, how decisions are made at the city level. We also engaged community, local, and national leaders. We even talked to folks from the Denver Star program, for example, and that's a model for non-police first responder alternative. And we were able to educate the public about what's possible. Then in the following year, we worked with stakeholders, experts, elected leaders, community residents to form the First Responder Alternative Pilot Coalition. And that's when we started embarking on that transforming 911 research. So again, when I said that the data was 2015 to 2020, call for service data made to St. Louis County Police Department, that's all the data that we had prior to that point. And then in the following year, we started advocating for a first responder alternative program in St. Louis County. That's particularly because, again, the first data that we had access to was from St. Louis County, and that was what would be able to inform our advocacy. In addition, we were thinking about various pilot areas, Ferguson being a place that would make sense, especially given our origins in the Ferguson Commission, but also our connections with elected leaders. So something that we talk about over and over again is that we can have data and research, we can have community support, but we do also need the willpower and kind of the organizing power as well as political will to make it happen. And so we started activating around transforming 911. And so what that means is that we held 3 community events across the St. Louis region. The attendance was around like 45 to 50 people. And we were able to share the top findings from the Transforming 911 report. We also hosted a facilitated conversation about what it would look like for us to implement first responder alternatives here in St. Louis. And so that takes us to 2023 right now. We're very excited to be releasing the full Transforming 911 report. You can access it at transforming911.org. You can view it, download it. And if you need a printed copy, maybe you know someone who's not very familiar with technology, or someone who is impacted by the digital divide, doesn't have as much access to a computer or internet or Wi-Fi, you can request those from us and we'll share a form with you soon. So moving on from that, what we heard from St. Louis community members is that when we are in crisis, we expect to be able to pick up the phone, call 911 and get help. But again, too many in our region have experienced the gut-wrenching moment when that help doesn't answer or takes too long to arrive. Like I mentioned, sometimes people are put on hold or hung up on with 911. And I want to emphasize that this is not the fault of call takers and dispatchers. It is a systemic issue. And so later on today, we'll get to talk with Erricka, who's on this call, on this webinar, to hear about a dispatcher perspective. Again, these are systemic issues that we as a region need to tackle around what kind of technology are we investing in? Are our responses equitable? Are we supporting the dispatchers in the way that they need to be supported? Is there training or codes that we can make uniform across public safety access points, things like that? So again, some mistrustful of our police system choose not to call 911 to begin with. So why do St. Louisans call 911, and how can that data help us transform our public safety system into one that best and most equitably meets the needs of St. Louis residents? This was essentially the two major questions that the report co-authors were trying to answer. Here are our really brilliant report co-authors, Karishma, Tiffany, Autumn, and Lucy. Thank you so much for all the work that you've done. And to the question that was asked earlier, who was the firm that we worked with? It was Datalytics, who provide data analysis support, and we're so thankful to them for that. We had several key questions. What does the region's 911 landscape look like? 911 in St. Louis, why is it used? When, how, and by whom? How much do police services cost, total and per capita? So we did an analysis of policing budgets, just because that is the department that is really the most invested in on a municipal level. And so if 911 equals police, as in most of the time, almost 100% of the time, when you call 911, you get an armed police officer responding. Is that investment in policing matching up with what St. Louis residents are calling 911 for? So, and then we also did an analysis of how police officers spend their time as well, which we'll get into later. And then finally, what is it like to live in this system? So that speaks to the storytelling component that I talked about earlier, but to inform the report, we did interviews with stakeholders from across the region and the 911 ecosystem. We had people working in the system like dispatchers, people who are adjacent to it in victim services or offices of violence prevention or the Violence Prevention Commission, and also people who are using it, just regular everyday residents. So if you want to look at this for a second to absorb the methods, you can. You can notice that most of it, again, was when it comes to why St. Louisans call 911, that data was from St. Louis County, and the analysis of St. Louis City data is forthcoming. We are already in conversations about that. We have gained access to St. Louis City data, so that is a major step, but we need to have conversations about how to make sense of that data. And as we go on in this presentation, you'll understand why that is such a challenge. Again, how incidents or calls are coded differs from public safety access point to public safety access point, and that makes it a major challenge as far as data analysis. So we're going to get into some top findings, sample findings, and stories. So if you tuned in for the advanced preview of the transforming911.org launch, this might be familiar to you, or if you've attended any of those community events, this is a refresher, but I've heard that it's always helpful to get a reminder, and it kind of gets your mind thinking about what could be changed about the system. So one of the major takeaways is that the St. Louis Region's 911 landscape is as fragmented, inefficient, and troubled as its policing and governance landscape. So it's not that the 911 system itself is uniquely inefficient, fragmented, and troubled. It is a reflection of the fact that our region as a whole is fractured. We have all of these municipalities, 88 municipalities by our last count. We have 53 police departments, and out of those, the public safety access points coordinate 911 services. So there are 15 of those. So as I mentioned, it's not just the codes in the software that vary, the training varies, the protocols vary by call takers and dispatchers across the region. So you can see how that is illustrated here. Something that was really fun was that I handed this report to someone who, works in advocating for more equitable responses around public safety. And they said they had never seen it really broken out like this before, the police departments and the public safety access points, that they never seen it on a map. They talked about it. They knew in their mind the different numbers that we were dealing with, but to see it on the map is something different, to really see visually how fragmented our region is. The other major finding is that St. Louisans use 911 mostly for non-criminal incidents, for example, service and medical reasons. And so when we say non-criminal, we use the categories from the FBI, kind of their analysis when it comes to crime data, essentially. And so when you look at the report, you can kind of look into more detail around that. But specifically in St. Louis County, calls for service for non-major crimes. And so Again, when we say non-major crimes, it's not that they are specifically all crimes. It's just that's the category that anything that major crimes is not falls into. So calls for service for non-major crimes outnumber major crimes 4-1. And only about 1 in 20 calls, 5.1%, were for violent crime. And so on the left, you can see in this graphic that, again, most of the calls for 911 are for service. So that's anything from a car is parked in the wrong place, or maybe my cat tripped off my home alarm. Those fall under service. And then the next biggest category is medical. So let's say someone has a seizure or a heart attack, or in the pandemic, if someone, needed to be brought to the hospital immediately because they were having trouble breathing, that would fall under medical reasons. And one of the other high kind of categories, larger categories, is traffic. So I think that's really interesting because there has been a lot of conversation locally around traffic enforcement, as well as how we can improve our transit and transportation infrastructure. Forward Through Ferguson does have the stance that we do think that traffic enforcement needs to be moved out of the police department into the streets department. And that is consistent with our overall stance that our responses in terms of public safety should be located in and invested in ways that center community and care for a more kind of design approach, something that takes into account public health. Here's a question. Is the last phone in the graphic supposed to be 2020? Last phone. Oh, these, because they look like phones. They do look like phones. They're supposed to be bars, but the illustrator kind of made them really large for impact, and it does look like phone. So you're asking, is it supposed to be 2020? Is the last phone? Yeah, that's a great point. Oh my gosh, did it get printed? Probably. Anyway, thank you for catching that. I think that would make so much sense, and I'm going to note that right now. This is why I'm so glad we're doing this. Last graphic. I love this. This is community engagement in action, right? 2020. Thank you. And Nicola's noting that right there. Oh, ha, it looks like a cell phone. It does. That's what cell phones look like nowadays. If you'll pardon me, I need to hydrate so I can keep making this presentation. Thank you. So moving on, this is kind of what I was getting to earlier. We looked at how policing breaks down in terms of the time that police officers spend on various duties. And again, this is because when we think about 911, that is one of the ways that people most frequently encounter the policing and judicial systems. And so if police officers, armed police officers, are most frequently the response to a 911 call, then we want to understand how are police officers spending their time and how does it match up with residents' needs when they call 911. So again, we showed you what the 911 call for service data says about what St. Louis residents need when they call 911. So now we're getting to the part of the police officer, the armed police officer who's going to respond to them. What do they typically spend their time on? And does it match up? So overwhelmingly, when we look at an average month in 2020, for example, which again, we can acknowledge was a strange year, and yet there's something that we can learn from data at any snapshot in time. When we look at every one of these squares, that represents 24 person hours. And what that means is it's essentially a term in terms of time tracking, or it's kind of an HR term, kind of, which is basically when you have 24 full hours of uninterrupted effort. So we know like a regular human is not going to be working 24 hours straight, but we're counting like the amount of hours that people are truly like working on their job. So most of it, the vast majority of the time that police officers spend is on something called miscellaneous policing. The next biggest category is for service, which is what we described earlier as those like, car is parked in the wrong place or house alarm is tripped off. Then the one after that is traffic enforcement. So again, as I mentioned, that is a kind of major thing to pay attention to, especially thinking about what happens as a result of traffic stops. You know, who is typically pulled over as a result of traffic stops. And then the next category under that is medical. The next category after that is defined by or called by the FBI as like the crimes against society. And then we have property crime. And then at the very last is violent crime. So I want to see if I can define miscellaneous policing for you, and I don't want to get it wrong, which is why I'm referring to my notes. So give me 1 second as I look through this handy dandy report that I have with me. And feel free to ask questions in the chat while I do so. I want to show you that this report is something that you can actually use. Here's a question. Hi, can you tell us more about the process to arrive at these recommendations? Was it a consensus? And if so, what entities, organizations were involved? What research was referred to in order to support your recommendations? Sarah, that is a great question. We haven't even gotten to the recommendations and you're already asking this. That is a great question. I would say, from my understanding, a lot of the recommendations were first authored by the lead author of the Transforming. You're very excited. I'm glad. I would say most of the recommendations were initially written by the lead author of the Transforming 911 report, which is Dr. Karishma Furtado. She's obviously a very brilliant data scientist and researcher. And so it wasn't necessarily that a bunch of people, I think, like when I think about consensus, I think about like everyone sitting around a table and they're all deliberating, like, we need to come up with a bunch of recommendations. What ideas do we have at the table? Raise your hand, raise your hand, raise your hand. So I would say that it was very much research informed from my understanding, because we are not the first people to have ever studied 911. Sometimes people get confused also because this project is Transforming 911 here in St. Louis, but there's also something called Transform 911 out of the University of Chicago, and that's worth checking out as well. There's a lot of amazing data and research out of there that we learn from. In St. Louis, you know, our effort is specifically to this context and also you know, connects with local grassroots efforts to advocate for more holistic public safety responses. But overall, what I'm saying is a lot of those recommendations were informed by the research done for the report. So as we said earlier, there were stakeholder interviews. There was a lot of an actual analysis of original data, original research and new data analysis. And then there was also interviews with stakeholders from people across the kind of landscape. So again, dispatchers and, you know, residents who are impacted by the system. And then research referred to in order to support our recommendations. So it was almost like, it's not like you come up with recommendations and then you find research to support it, right? It goes the other way around. So there is national research, and it is something that is consistent with our recommendations, and there is national research around more equitable crisis response. So again, with the health lab, that's amazing. Everyone, please keep asking questions. Sarah, you're a great example, and I'm going to flip through this report to find that answer for you. And also I can connect you with Karishma if you want to go into further detail about that. So I found this part. I'm not even looking at myself on the screen. So let me see if I can, I'm going to take off my virtual background so you can see this report. Hello, I'm in an office. So there's this page called Action Steps, and that's the beginning of the recommendations. And so here it says, Rebecca Newstetter, a national expert on 911 and public safety transformation, along with her co-author, educational equity attorney Katrina Feldkamp, share 3 principles for devising more equitable emergency response systems. Number 1, prioritize community-based responses that center health, wellness, and transformative approaches to harm. Number 2, limit police response to the most necessary of circumstances. And 3, reject haphazard fixes like deployment of alternate state actors who perpetuate criminalization of oppressed communities. So, like, to summarize all of that, to my understanding, it's making sure that whatever crisis response we have is centering health, centering transformation, so that it's not just punishing, it's not just controlling. We want to limit police response because of the potential for harm and escalation of force. We also want to limit kind of small reforms that would basically keep criminalizing Black and brown people, to be very frank. So looks like there might be another question. And I might just keep my background off for now, just so that I can make sure to keep showing you the report. Okay, great. All right. All right, so I'm being encouraged to kind of move along, and I'm going to double check where we are on time. It is 6:40. All right, I want to move really quick because I don't want to miss these speakers, and they've really lended their time. Brian in particular is sitting in some parking lot, so I need to save him. St. Louis tends to outspend other American cities on policing, but we're continuing to increase investment in our current arrest and incarcerate approach. You can see that just recently we spent over $5 million on policing, about $420 per person. You can look at these graphs on the left at transforming911.org, as well as the full report, just to see how we compare with other major cities. And in St. Louis and similar cities, this also kind of has an effect on the local level. Policing gets more local funding than other municipal services. So essentially, we're sacrificing the ability to invest in other things like health and human services in order to keep investing in policing at such a high level. So in a majority of St. Louis municipalities that we examined from a staffing perspective, police departments were the most heavily staffed department, with an average of around 2.5 full-time employees per 1,000 residents, or 40% of the average total 6.5 municipal employees per person. So the next largest departments were often half the size of police or smaller. So this is just, I'm not going to show you this video, but this is a video just that showcase what is at stake in terms of community residents who often say we keep us safe, who trust their neighbors, their family members, their friends to respond more than 911 would. So I want to move forward to the current 911 landscape, and I want to introduce Brian Maydwell, who is the Missouri 911 Coordinator, Executive Director of Missouri 911 Service Board. As a reminder, please ask questions in the Q&A area, and we'll answer them there or answer them live during the webinar. Since I've paused so much for Q&A, I'm going to wait until after Lauren speaks to take questions, unless I look at one and I'm like, okay, we need to answer it right then and there. So let me make sure that Brian can get on the screen, or we can hear Brian. Brian, can you say hi?
Hello.
Oh, okay, awesome. And Erricka, can you wave if you heard him? Okay, awesome. So Brian, thank you so much for being here. Can you tell us how you got involved with the 911 system?
Actually, yeah, I started off in public safety 25 years ago. That was actually started off as a field responder, as an EMT and a firefighter, which I continued to be for about 18 years. And then I started about 23 years ago in 911. When I started off in the field work, I actually learned that there was a different version of public safety that included 911, which I personally kind of classified it as the public safety version for nerds, and it kind of worked with me, and it seemed to work out really well. And I really love the actual kind of the constant different aspect of every call you took was different, every day you had was different, and you seem to do quite a bit of difference in your communities when you're working there, just due to the sheer volume of calls that you have. So my perspective was basically, as a field responder, I could respond to about 5-6 calls a day. As a 911 call taker or dispatcher, I actually responded and took hundreds potentially of calls a day, if not if not more. It's just going to depend. So that's kind of how I worked my way into 911.
Wow, that's amazing. Thanks so much for sharing. And it seems like you like for every day to be different. You want an interesting job. Well, so 911, unlike you, for most people, 911 is something we don't necessarily think about until we need it. I would love to know maybe 1 to 3 misconceptions that you think people might have about 911 and just kind of for you to debunk that. Is that something that you come across when you talk to people?
Frequently, actually, there's just a large disconnect of what a 911 system is, how it operates, and what happens when you call 911. So the understanding of the behind the scenes of how 911 works, it's far more complex than most people would imagine. Interestingly enough, people within the public safety system, responders, once they learn the 911 system and how it works, the actual dialing of a 911 from a phone, and then actually that routing to a PSAP, it's far more complex than you might think. But one of the biggest misconceptions, honestly, is that if you're a dispatcher, you've probably experienced this. I'm sure Erricka has. Is that they assume whatever they're dialing 911 for, that you're the representative of the department they're looking for. So if they have a fire, they think you're a fireman when they dial 911. If they have a medical issue, they think you're a paramedic or a doctor. Or if they need a law enforcement immediately, they think you're a law enforcement officer. So it becomes that you're automatically assumed to be a member of that department, and that just the act of dialing 911 has routed them correctly to the appropriate response or resource. Whereas actually, in most instances, dispatchers and call takers and telecommunicators, they're actually civilians most of the time. They're civilians. They might work for police agencies or even independent 911 agencies. But a lot of times when people dial 911, they have an assumption that they're talking to someone that is directly related to their emergency and or representative of the agency that they're looking for, where they're actually 911 is oftentimes a completely separate entity. Sometimes not even under a police department. They could be a separate governmental entity that's under a 911 services board too. So.
That's really interesting because, I think that speaks to a kind of lack of understanding, not necessarily on the fault of residents, but just it's so hard to imagine how vast the 911 system is and how many calls you're really dealing with on a day-to-day basis. And I assume that, not only are people calling and assuming that you are answering for the department they're trying to reach, but sometimes people might be thinking that their call is the most important call when they have no idea all the other calls that you all have to get through and triage. So how would you describe maybe a day in the life of your role as Missouri 911 coordinator, or what does that even mean?
So the state 911 coordinator, I'm the representative kind of from the state 911 board. And the 911 services board, just to give you some context, is a governor appointed board. So they appoint the board members themselves, and then they can be approved by the Senate, or if the Senate's out, they just get approved and they become members of our board. And it's a 15-member board. Currently, we have 9 folks. We've just added recently 5 others, and one of them's retired. So I think we're up to 11, 12 now potentially, but I'd have to look again. We're having some orientation for some of our board members tomorrow. So that was just a recent event that happened that we've added some board members. But the board's focus specifically, and why I work for the board, it's going to sound a little bit strange, but I'm not even a state employee. You would think that I work for the state and the board is a state entity. It's actually a separate board. A little bit separate from the state, but it is appointed by the governor. The funding that they get is through what's called the 911 Trust Fund, which is 3% on prepaid wireless phones. Actually gets routed through the counties or through the Department of Revenue, and depending on the size of the county, if it's a Class 1 county, they'll get 60% of that revenue back. If it's a smaller county, they'll get 40% of that revenue back. The rest of that revenue goes to the 911 Trust Fund, and that trust fund is to help elevate the level of 911 service throughout the state. And the reason why that's important is to understand that we have a saying that if you visited a PSAP or a 911 center, you basically visited that 911 center.
Yeah.
All completely different. So it's a matter of the 911 center in rural Missouri looks very different compared to a 911 center in a suburban area or an urban area, basically. And they're all different and all really driven by the local communities is the big part. Is that the 911 system, much like the rest of Missouri, is very home rule. that
Yes.
they can get their local funding and things like that, and they can get information. But the way Missouri generally works is that governance is usually tried to maintain as close to the citizens as possible, that you can directly go and talk to your commissioners, you can talk to your city alderman, you can go and talk to your city council members and things like that, and address an issue you might have with your local community, basically.
Yeah, I can really relate to that coming from St. Louis City, and very similarly, if you go to one ward, you've been to one ward. It's very different neighborhood to neighborhood as well. And there's pros and cons to the home rule thing, and in terms of kind of advocating for large scale changes, it's hard to kind of impact a system when it's so piecemeal. So related to that, how would you describe the current process of PSAPs? For those of you who don't know, it's public safety access points. That's the area out of which the 911 call takers and dispatchers essentially dispatch the calls. How would you describe the current process of PSAPs integrating 911 with 988? So 988 being the new national suicide and crisis lifeline hotline.
And again, due to the home rule, it's really kind of more right now on an individual basis. So each PSAP kind of has its own governance and its own who's in charge of it. We can provide some guidance from the state level, and we provide some connection and information out. But what generally happens is that local PSAP will work with their 988 center, like Lauren runs for Compass Health Network, and they'll make contact with a group at the 988 center, and they'll have discussions about, okay, what does this look like? Here's what I would like to do with our community. Here's what our citizens are giving us feedback on, that how they would like a response to look like when someone's calling 911 instead of calling the 988 number. How do we transfer you appropriately? And how do we get the resources to support 988 if they need any sort of response, that sort of thing. So it's really kind of more each individual community is going to make that decision and how that moves forward. And I know that Lauren's got some pilot projects throughout the state that she's been working on, but there's also, correct me if I'm wrong, Lauren, 6 other 988 centers within the state of Missouri that are also doing the same thing, reaching out to PSAPs that are in their service area and communicating with them of like, here's what we do. And 988 call takers are actually going and sitting in 911 centers themselves and kind of interacting and discussing of what that looks like. 911 centers have talked about sending folks to 988 call takers to see what that looks like from their perspective. So there's an understanding of what kind of calls they're taking and what it looks like on their end versus what it looks like on the 911 PSAP end.
Yeah, thank you so much for bringing Lauren into this conversation. So I think that's a really great chance to start speaking to Lauren. Those of you who have questions for Brian, please put them in the Q&A. Brian, and thank you so much for your time. We know you're on the road, so when you need to, feel free to pull off. And if you're not on the call anymore, we'll be sure to pass on the questions to you. If you have a chance to answer them, we'd love that, and we'll plan to share that out with the people who attended later.
It sounds good. I'll stay on as long as I can have a cell phone connection. So.
Thank you so much, Brian. All right, Lauren. Well, so I want to introduce Lauren Moyer, Executive Vice President of Clinical Innovation at Compass Health Network. Lauren, thank you so much for being here.
Yeah, thank you for having me.
All right. So Lauren, can you please tell us how you got involved with the mental health field? Like, what was the kind of first time, or when was it that you're like, this is the type of work I want to do?
Yeah, well, that goes way back. So I've been in the mental health field for probably about 20 years. But to answer your question specifically, I hail from the Kansas City area, but I do work across the entire state of Missouri. With Compass, we're in about almost 50 counties. So we have a broad reach, and for 988, we service 25 counties. But I actually started out working at the Chiefs Stadium when I was younger.
Oh, gosh.
Go Chiefs, go Super Bowl. But I will tell you that I worked in the really kind of the crowd control and the parking, area. And I will tell you, there is a heavy influence of crisis de-escalation techniques that you have to learn very quickly with people that are publicly intoxicated.
Okay, it's all coming together.
That have a lot of, feelings and emotions whenever they don't necessarily see their team win. But then also people that truly are struggling with mental health and substance use issues and suicidal issues. You know, I had a lot of interactions with people who did want to die by suicide. Unfortunately, you know, it happens anywhere in our community. So I was definitely aware of that at a very young age, and also helping to assist our first responders to kind of de-escalate those situations.
Wow. So what a start. It sounds like you're a big sports fan, and what you're saying is that kind of people in crisis or people need help in a lot of different settings. And you know, when that happens, you want a good team around you, and you want people to de-escalate. You don't want people to just kind of force you to, you know, do one thing or another or harm you. You want support. You want someone to understand. You want maybe like a soft voice and someone who understands where you might be coming from or is willing to ask questions. So, you know, we've been talking and alluding to 988 being the new National Suicide and Crisis Lifeline or hotline. We see that's in your kind of background. It is something that is different from 911. They're both numbers that you call, but they're different systems. Can you just explain a little bit more about that?
Yeah, so I am our state's 988 task force chair, and I can share with you that as a state, we really took our responsibility to heart when we heard about 988. And so our intention was not just to be able to answer the front end call when someone is calling for immediate support with a mental health, substance use, or suicidal crisis issue, but it was really about how do we strengthen our crisis system of care. Inadvertently, there's been a lot of gaps created in our behavioral health system over the years because crisis is heavily underfunded. And with 988, we really were able to advocate to our state to be one of the only states in the nation that actually got initial funding for our 6 988 crisis call centers to staff up because we knew that the call capacity after promotion nationwide was really going to increase. We also know when someone is in a crisis, why 911 is so frequently used. It's easy to remember. Mm-hmm. So when we give out 1-800 numbers in 25 different community mental health centers, people don't remember that. Mm-hmm. And so 988 really was, you know, created to give a really quick and easy reminder for folks. Definitely not replacing 911, mm-hmm. but as a support to really proactively and preventively get on the right path so that we don't unnecessarily have to use the emergency rooms, our police officers, our 911, you know, PSAPs. So our intention with 988 really was to build our crisis continuum, be able to answer the phone, have someone to respond into the community when that was needed. So being able to go to someone's home if further help is needed. And then also a third piece of 988 is our behavioral health crisis centers. So actually a location that is an alternative to the hospital emergency rooms.
Oh, interesting. I don't think I really was aware of the kind of alternative place as well. So that's interesting. We learn something new every day. I would love to know kind of how you would describe the current process of the kind of PSAPs integrating with 911 with 988, similar to kind of what Brian was talking about. We would, I think it'd be really interesting to hear about the status of implementation in St. Louis specifically. When we talk about 911 at community events, a lot of residents do bring up, well, how does that interact with 988? How does transforming 911 impact 988? So what are your thoughts on that?
Yeah, so I want to give you some data points first, and then I'll talk about our next steps. Mm-hmm. So we have officially taken about 48,000 988 calls since July of 2022. We are in April, Missouri actually achieved the best in-state answer rate and best average speed to answer among all states in the nation.
That's really interesting. So you said 44,000 for all of Missouri?
We've had 48,000.
48,000.
crisis
Okay.
calls. Uh-huh.
And I want to put that into context for folks, especially since we're connecting it to 911. In a given year, so I think it was like 2018 for St. Louis County Police Department, the calls for service, there were 4 million to 911. So that's not to say that 988 isn't being used, but this is kind of really impressive that you all are trying to make sure that people actually know about this new number.
Yes.
And it also illustrates the importance of integrating the two systems because 911 is so heavily utilized.
Yes. And so to your point, we know that it is a much smaller amount of calls, but they're still calling our direct lines because unfortunately we don't have the geo routing capability that 911 currently has. So oftentimes if someone is calling us, but they maintained their out-of-state number, they would get routed out of state. So we prefer they call our actual line. So for instance, like for us as a crisis line provider, we may have answered 800 988 calls this past month, but we answered 4,000 calls to our actual crisis line. So there are people reaching out. They're just not necessarily calling 988. And so it's really a community effort to let people know when you call 988, our goal is to completely divert from all the other first responder system. So for instance, 0.6% or let's just say 1% or less of the 988 calls we ever engage 911 on. So we truly are trying to divert from ever having to kind of escalate it to that level.
Yeah.
So with our 911 PSAP partners, we have 185 in the state of Missouri. And so they are all very unique in how they are set up. So we are having to individually go to each PSAP provider. And what we're doing is setting up a call transfer, a call diversion, and more importantly, a relationship. So we're really trying to let them know like, hey, when you have a behavioral health related call, or your top utilizers of behavioral health, like please transfer them and let's help educate them to call 988 so that we can really truly divert and be able to send out the necessary supports versus perhaps people that are not trained to de-escalate a behavioral health crisis.
Yeah, that's really helpful. And to clarify the statistics I gave earlier, again, with this handy dandy report that I have in front of me, that is really easy to reference. It was between 2015 and 2020. My brain to remember numbers is not the best. St. Louis County Police Department received around 4 million resident and officer initiated calls for service. So all the calls to 911 essentially, or to the police department. So like if a resident is calling for service, that's a 911 call. If an officer is calling for service, that's kind of within the system already. So that's 4 million across 5 years essentially. But it still kind of shows we're talking on the kind of more million level versus like the 10,000 level that you're talking about with 988. And I think that's really interesting that you're really highlighting the potential of 988 to lift off the burden off the current system. And yet there's all of these additional steps. So the step of making sure that the call's in the right jurisdiction, you know, what you said about receiving calls, but it's from the wrong state, that also happens with 911. We know that. And then the other part of, you know, if you're encouraging PSAPs to refer to 988, that's even another step. So I'm really fascinated to know what Erricka thinks about that as a dispatcher, because they already have so many steps to go through. But before we get to Erricka, I'm curious to know around non-police first responder alternatives, which is something that Forward Through Ferguson is advocating a lot. If we're able to strengthen or expand the amount of crisis response alternatives, how do you think that impacts 988? Because right now, it seems like we're at a stage to basically increase awareness of 988, that it even exists. But you mentioned there's other things that are part of it, like making sure that there's places for people to go who have behavioral health issues.
Yeah, so I think right now, both with our crisis call centers, with our mobile crisis response that goes to the person in the moment where they're at, as opposed to meeting them at a hospital or meeting them at jail. And then our behavioral health crisis centers, we have capacity. We have additional capacities to support those reaching out and needing that level of support. I think right now we're really just trying to educate the community to utilize us, or tell us how to be used, or tell us where we need to go to do, you know, the 988th presentation, right?
Interesting. So there's this question from an attendee. Is this panel going to address the concerns of 988 within the mental health service provider field? A lot of providers do not support 988. So I think this is referencing the idea that we're still working in this system that relies on police to respond. And so maybe for the same reasons that people don't feel comfortable calling 911, people might not feel comfortable with 988. I personally have seen on my social medias among organizers and activists who really care about harm reduction or kind of de-escalating situations don't use 988. And it's because we're still dealing with this system that is within an arrest and incarcerate model. So in your conversations around 988 and implementation, how are you all dealing with that?
Yeah, you know, I think it's a reality, especially if they've not used the 988 process and kind of seen a different response. But we just continue to share the stories of successes that we constantly have. The number of calls versus how many times we have to engage 911, again, is less than 1%. And so I think that speaks volume. In fact, the only time that we are engaging 911 are very, very critical events where someone will not tell us where they're at. They will not, they will say they have a gun to their head, right? And so it's that type of situation where we are having to find them for their safety to help support them in the moment. Otherwise, you know, we do definitely have pieces in place that we can access. You know, we have licensed trained clinicians over the phone that are helping provide those safety plans and supports. 90% are able to be handled over the phone. That additional 10% is where we utilize that mobile crisis response or getting access immediately to our behavioral health crisis centers that are open 24/7.
Yeah, so it's something that I'm hearing that maybe because the current system is so limited in terms of sending a one size fits all response of armed police officer, that's all you have to rely on for that so-called 10%, where it's a lot more complex of an issue where someone is in danger of harming themselves or other. But if we are able to have, you know, highly trained non-police first responders who are better at de-escalation, who understand a behavioral health crisis when they see one, who understand various things that can impact a person's mental health, who are maybe more embedded in communities, you know, this is so-and-so's son, or this person is always living here, it's not like a big issue and isn't so threatened by people, that maybe that would be able to strengthen 988 as well. Something I want to lift up as well is that when I had conversations with Casey of 988, who introduced me to Lauren, can you remind us what Casey's title is for people who don't know?
Yeah, Casey Muckler is the crisis specialist for the Department of Mental Health.
Okay, great. So Casey, when I asked her the same question, because I had similar concerns also, because Forward Through Ferguson, we're always looking for more equitable responses in terms of public safety. She linked me to a report called Embedding Equity into 988 National Scorecard. So this was a report that came out July to October 2022 from the Kennedy Satcher Center for Mental Health Equity. It's with the Satcher's Health Institute and the Morehouse School of Medicine. So I highly recommend you check that out if you're interested in this subject. I'd love to go more into it, but we've got more of this webinar to go. Thank you so much, Lauren. I know it's been a long day for you. So any additional questions that relate to 988, I'll be sure to pass on to you. Thank you so much for making yourself available.
Thank you.
All right, see you. So Erricka, this is like, how many times have we interacted at this point? Multiple. Maybe we should start with the first time we met. So I'm going to introduce Erricka. Erricka is the founder of 911 for Kids, which is a nonprofit to educate kids about what 911 is, and currently working for West Central Dispatch. And then also, had many, many years with St. Louis City 911 Dispatch. And I want to acknowledge Lauren, when you need to hop off, all good. And then Erricka, I remember you reached out to me, you sent me an email and you're like, hey, I see you're working on transforming 911. Can we talk? And then you were in an IHOP, and that was so great. Of all the places to meet, and I was like, okay, we're going to Zoom while you're in an IHOP. So Erricka, tell us how you first got involved in 911, or maybe one of your earliest memories of.
Okay, first, can you hear me? Because
I can hear you great.
Okay,
yes.
Cool. I started out as I was working at General Motors, and I was a school bus driver before I became a 911 dispatcher. I guess you could say I always wanted to help people. So once I moved into 911 and just wanted to be there and wanted to help, it was up from there. So I was with the city for 6 years. After being overwhelmed there, then I went to West Central Dispatch, and I started the nonprofit, and it's just been going up from there. So I've been really blessed with a lot of great opportunities.
Well, I love the description of going up from there, because I think it is very optimistic of you to say, because you face a lot of challenges as a dispatcher. Something that we know is that the rates of PTSD among dispatchers are far higher than even for police officers. I think there was a study where it found that the rates of PTSD for dispatchers are close to like 30%, whereas for police officers, it's like 10%. And then for the general public, it's even lower. So can you tell us about some of the kind of daily stressors or challenges of a dispatcher that people should know about?
Especially the long hours. I think people should know that you have several people who have worked for more than 8 hours there. They've been there for 16 hours sometimes. Myself, I was 8 months pregnant, and I was still working 16-hour shifts because I love doing it, and then also wanting to help the community. We are not police officers. We are regular people, and I think a lot of times when they call, they forget that. I am not an officer. I am not a firefighter. I am a regular person just like them. So I think being exhausted, and then different areas, different precincts, I should say, you work, some work on 2, off 3, or on 3, off 2.
What does that mean for people who don't know what that means?
So you would work 3 days straight and then be off 2. However, when I worked for the city, we worked 7 days straight, and then we were off either 3 days or 4 days, and then we would come back and work another 7 days straight. So you have to kind of see that we only got 1 weekend off in the month. So when you do the math with that, so you have people that are overwhelmed, overworked, and I think a lot of people don't realize that when they're in crisis. I get it, you want help right away, but if you take a step back and think about the situation, you have people who are overworked and underpaid.
Yeah. So for those of you who kind of saw in the background me flipping through the report, I get so excited about this report. I want to look at everything, but I'm just going to say it from my brain since I couldn't find the page. But basically, there's a part where it talks about dispatcher experiences. It does talk about those long hours, but it also talks about things like you don't necessarily get your own desk. So it sounds like a small thing, but when you spend most of your time there. And like Erricka said, if you have 1 weekend out of a month, that's really hard. You can't personalize it. You can't have the things that make you feel comfortable. Can't even have maybe, your baby that motivates you to like get up and every day and do what you do. And so that's challenging, but there's also kind of more serious things like whether or not you're classified as a first responder. So since the creation of the report and since the data analysis that we did and some of our advocacy and connection to elected leaders and putting pressure on certain issues in St. Louis County, that 911 dispatchers are now considered first responders. And what that means is they have access to different levels of pay, benefits, and protections. And so that's really important. That's not something we see in St. Louis City yet. And that's something that we're hopeful could change. And that's a recommendation that we have as well. The other part that dispatchers are dealing with is varying levels of pay. You're not guaranteed like, a set kind of pay, but it varies from public safety access point to public safety access point. So let's say you move from one area to another, you want to get a job that's closer to where you live. Maybe you made something at one place. It doesn't mean that you're going to exactly make that in the other place. And then also the requirements are different as well as far as your background. Like, if you need a high school education, if you need advanced education and training, that varies. And then as far as career opportunities, that's something we talk about in the report as well, that sometimes dispatchers feel stuck and they feel like they can't move up in their career and they have to stay in this very stressful, traumatic job, which is really hard. So Erricka, we have talked a lot about your kind of day-to-day reality. I want to kind of talk about what happens on the other end of the line. So something that people don't always understand is like when they call 911, what's happening? What are the decisions that you have to make on the other line? And how might that contribute to their experience of if they're hung up on or put on hold? Is it you just being like, I personally don't like you, beep?
Right. I think what people need to understand is we are not hanging up on you. Every center has a automated line that picks up if there's too many calls coming in and you only have so many people plugged in. By plugged in, I mean we have headsets on and they're plugged into the outlet so we can get the calls. If I'm on the line with somebody and then there's only one other person that's working and they're on the line as well, well, guess what? You're going to go to the automated, line. It's going to constantly keep playing over and over again until the line clears up and I'm able to answer your call. I know it's important that people need to understand if you have to call 911, it needs to be an emergency. There a lot of things can be nipped. Calling for parking issues. Somebody's parked in my spot. That takes up a 911 emergency. When somebody has a serious emergency and a person is calling for something very small and minimal, especially knowing in the city they don't have very many dispatchers that are answering 911 calls because of the pay. It's important to understand that, well, is there another route I can take or another number I can call so I'm not on the line, when somebody's calling in with an emergency. So no, we do not hang up on you. You are being sent to a automated, just a recording that's going to play over and over again until I am able to answer your call.
Yeah, and that's something we talk about in the report too, about those kind of 911 calls that aren't real emergencies. And so unfortunately, given the world we live in and just kind of the racial bias that exists and people using 911 essentially as a customer service line, some people might see like a kid playing, maybe they're a Black kid and they're in a neighborhood that they feel like, well, that kid doesn't belong, or maybe that kid isn't doing what I think they should be doing. They might call 911, but that means that that's taking up your time, Erricka, away from some other serious issues. Someone might be bleeding out. Someone might be having a seizure. Someone might have had just a car accident. Someone might be having a mental health crisis. Something that we talk about in the report is the impact that it would have if we were able to allow dispatchers to exercise more discretion and also to have training on, racial bias and cultural sensitivity. What are your thoughts on that if you were able explicitly, to make those decisions?
I think it's something important that needs to happen within the 911 centers. Having that sensitivity to different people that are calling, everyone's not like you, recognizing that people need to be treated with respect on every call. I think that's important and it needs to happen immediately. within, the 911 centers. And also, I think people need to understand that when you're calling 911, we're in 2023. Every officer is not going to be the same as you. They're not going to look the same as you.
Right.
We don't have special requests when you're calling 911. If you have an emergency, speaking of myself, if I have an emergency and I'm calling 911, I don't care who come as long as they're coming.
Yeah.
So asking for a white officer, asking for a Black officer.
That happens in hospitals too. People being like, you're not
like-
my doctor. I never seen a doctor like you.
It is complete. It's sad because, like I said, we're in 2023, and at this point, something needs to give and it needs to stop. So I think it goes both ways within the centers and also with the community. Like, you're not going to get somebody that looks like you. We all are here to get you help. Most of us, I will say, I'm speaking on myself. I am here to get you help and to get it as quick as possible. Unfortunately, there's so many calls pending. There's so many emergencies all over, and we don't have enough resources. So that's the big issue, but it shouldn't matter what color somebody looks like. If you need help, you need help.
Yeah. Well, kind of related to what you said earlier, it is 2023. So much has changed and so much remains the same about what needs to change around equity and just justice in general. On page 33 of the report, there is what we have as the headline, kind of a stage set for disaster, the case of Tamir Rice. So if you remember Tamir Rice, that happened, his experience where someone called 911 when they shouldn't have. And that happened in 2014, same year that Michael Brown Jr. was killed here in St. Louis. And so there's one part where it says, there's no indication the call taker entered critical clarifying details into the computer record. And that was from Dr. Rebecca Newstetter, Executive Director at University of Chicago's Health Lab, out of which Transform 911 is working. So she said the information should at minimum have included the skepticism the caller shared, noting this might be a kid with a toy. Proceed with caution. So, there was a prosecutor who said in a statement that police radio personnel errors were a substantial contributing factor to the tragic outcome. Had the officers been aware of those qualifiers, the training officer who was driving might have approached the scene with less urgency. Lives may not have been put at stake. So again, this is where the limitation of like this one size fits all approach, always sending an armed police officer, is challenging, can cause harm because there's all of these details that happened, and then you're erring on the side of sending an armed police officer. And unfortunately, this fatal incident happened that killed a young boy who shouldn't have been taken from this earth. So kind of bringing it back to just your everyday experiences, is there something that has been on your mind lately that you were like, I really wish the public knew about this around 911, about the things that we're dealing with?
Just mainly something you said earlier. I got it. I wrote it down. Let's talk about this first. When you call 911, whatever tower you're pinging off of, this is important. If you are downtown and you hit a certain tower, you're going to get Illinois.
Yeah, because
hit
it's
another
close.
tower, you're going to get the city. So that's something you said earlier about towers and calling 911. So I wanted to point that out as well with people. You're sometimes you call and you want a certain city, you're not going to get it.
Yeah.
And we have to transfer you. But what really I think citizens should know about is how many people are actually answering these phones in downtown St. Louis. We touched on that last time. At times, there's only 2 people answering 911 calls for the entire city of St. Louis for an 8-hour shift. So if one person gets up and takes a break, then how many people are answering? 1. So if that one person's on the phone, then here goes the recording. You're getting the recording. So, and then also, no matter whether you push, I need EMS, and then you think EMS is gonna do something about your police situation, EMS is going to send you right back into the queue to wait for the police. So it doesn't really matter. All calls go into the same queue. I know they spoke about that it's all separated, non-emergency, emergency, but it's not enough people now at this time. So all the calls, non-emergency and emergency, are in the same queue, and they go one by one. So it's not separated. And I think that's what people need to know, that it is not separated currently. It is still in the same queue.
And so my takeaway from that is like, have so much patience with the call takers and dispatchers, even if like you're dealing with something really stressful or in the aftermath when you're thinking about it, because you all are dealing with so much. You're dealing with this very imperfect system, and it's worth transforming for your sake, because you're the ones dealing with it on the front lines, and then also for the sake of residents who need help. I don't know why my mind went to this. Maybe it's because I'm hungry, but I'm remembering this one time I was at Burger King, and it was like, you know, staffing affects everyone, right? We've had so much issues with staffing as a result of the pandemic. And I remember like pulling up to the drive-thru, you know, my mom loves Burger King, so I was there, and they're like, oh, I'm so sorry, there was a spill. We have to deal with it. And then basically the whole Burger King shut down for like 20 minutes. And I was sitting there like, should I idle? Should I park? Like, I don't know how long I'm going to wait for this burger. And there's like a line of like cars behind me, like probably like 5, 10. And it was just like, how long are people going to wait for this burger? Eventually I left. But the thing is, like, what we're talking about is that with 911, you're not dealing with just a burger. You're dealing with like real lives. And so Ericka's like, how did you segue into this? But, you know, that's the thing. Like, staffing is an important thing. Support is important. I think you really bring up a good point, both about the cell phone towers and also about, you know, all the calls in one queue, because something I'm thinking about is that in the report, it brings this up too, that fire is a separate system as far as how they code things. So if you have a fire, you're calling 911. First of all, it has to be in the right jurisdiction. So maybe you have to transfer, et cetera, and then you have to ask them what's going on. Then you have to code that. And then you have to transfer out to fire. And then fire is going to ask the same questions again. And it's not because like, you know, they want to.
Yeah. So like, this is, y'all know I'm gonna keep it real. So when you call 911, so you're going to hear me say, and I speak about city because I'm from the city, and I actually really loved working there. So I'll be like, St. Louis City, 911, Erricka. You're gonna say my house on fire. Okay, hold on for fire alarm. I'm gonna connect you. They're gonna ask you the same thing. This is fire alarm. You know, they're gonna say their name maybe, and what's the address of your emergency. So I know it's frustrating when you have to keep repeating, because we do it on EMS as well. You have to repeat the address once you came over from police. But what also people need to realize is there are protocols. So if I don't follow a protocol, I can be fired. I can be sued. So,
and protocol is that list, like that path of like, if this happens, then you need to say this. If this happens, you need to say this. You need to press this number, etc. And what we said earlier is that protocols differ from public safety access point to public safety access point. If you got trained, Ericka, at one PSAP, and then you ended up working at another PSAP, which you did, is might be different, you know?
It is very different. So when you go from the city where it's busy and you're like, you know, clockwork, and then you go, you know, to a county where you get a call every 30 minutes or every 15 minutes.
And maybe you're staffed differently. Maybe you have more staffing because you have that, and then you can spread those calls out.
Right. So it's really different. And I think everybody should have that experience though, of going to different agencies, so you can know oh, this happens here, and why doesn't it happen here? Maybe we need to put it into, this place. So
Mhm.
I think everybody, whoever's a dispatcher, should have that experience of going to different agencies and working for them. Yeah.
Yeah. And that's what equity is, right? Like at Forward Through Ferguson, we always say, like, it shouldn't matter where you were born, which neighborhood, which zip code, what your race is, like you should be experiencing what you need to experience around support, around care, around your opportunity to thrive, around whatever education systems, and 911 response falls into that. So we talked a lot, Ericka. Thank you so much for your time. Can you tell us, like, what's something that keeps you going? You work so much, you're so passionate, and you're still an advocate. Like what's happening?
What keeps me going is just my kids. I have a 10-month-old and a 16-year-old gonna be 17. Don't ask me why. They keep me
I
going.
like the way they interact though.
Right,
The
they love-
16-year-old
God.
is chill, and the 10-month-old is like, I'm the smartest,
Yeah,
cutest,
like, I'm
juiciest
here.
baby you've ever seen.
So I think just the kids keep me going, and just knowing that, having empathy for others, and just honestly, I was raised to be a good person and just try to do the best I can in every day. I'm not perfect, but each call that comes in, I really put myself in that person's shoes. And when it's serious, it's serious. We do have those calls where, why are you calling today? Because it's not serious. Or, they just want to talk to somebody, which is okay. Hey, how you doing?
Yeah, like a lonely
But we
person.
got other calls,
Yeah, right.
But I think it's just having, like I said, empathy for people, having respect for people, and just wanting everybody to be, well, and that just keeps me going. So
Yeah. Wonderful. Well, thank you so much, Ericka, for spending this time together. It's always good to see your face. I don't see any questions in the chat for you, but I'm gonna dismiss you if you want to be dismissed. I'm sure you've got dinner and things to do. Yeah, peace out. Peace out, Jessica. And so you can spend time with your family. Anyone who has questions, feel free to email me. I'll share that email later, and then I can forward that on to Ericka and be like, the people need to know, like, what is it, what's your favorite coffee or something? Like, what is it that's fueling you through your long days? If you had to choose one weekend per month, what do you do with it? I don't know. So I'll make sure to pass those on with you. Thank you so much for everything you do. Thank you for all your service and your care for our region.
thank you. Bye.
Bye. All right, it's just you and me, y'all. I'm gonna share my screen again, back to the presentation. So feel free to keep asking questions. I went over this already. Look at this. The principles for equitable emergency response systems. I listed them here. That was in response to the question about, like, how did we come up with the recommendations? So Sarah, it is your turn to shine. And by shine, I mean hear what some of our recommendations are. So again, this is a snapshot. We have limited time here. So I encourage you to look at the full Transforming 911 report at transforming911.org to see the full list of recommendations and start, doing these fingers, like planning on how you can advocate. So the recommendations are in these various categories. We have ones around structure and placement of 911, essentially moving 911 out of the police department, and just having it under public safety overall. Then we have streamlining and modernizing the 911 phone network. We talked about this at length before, that basically, we all have cell phones, or many of us have cell phones now. Very few of us use landlines, but the 911 system was created at a time for landlines. And so that's very limited in terms of geolocation and things like that. There's recommendations related to the 911 call itself and improving that. Recommendations about training and making sure that's uniform and streamlined, and also addresses things like racial bias. Recommendations about accountability, dispatcher as profession, and finally, and my favorite, if I can have a favorite, civilian first responder programs, which is what we're advocating for at Forward Through Ferguson. So I say top 3. This doesn't mean these are like the most important ones, but these are the ones I'm highlighting for you today in this webinar. Again, the full list of recommendations is in the the Transforming 911 report. So number 1, we have seat 911 within the Public Safety Department. This is, again, related to moving away from the arrest and incarcerate model and thinking about crisis response from a health-centered, trauma-informed perspective. Then we have classified dispatchers as first responders. I already touched on this earlier in the webinar. And then finally, establish non-police civilian first responder alternatives. This is something that is possible. It's happening in cities across the US. There are models that exist, and St. Louis can be yet another place for a model. We at Forward Through Ferguson are already engaging with community residents to talk about what it would look like to implement non-police civilian first responders programs here, what kind of things we want to prioritize. We heard overwhelmingly that people want to prioritize behavioral health response in any sort of non-police civilian first responder alternatives. We want de-escalation, we want restorative justice. We also asked about traffic enforcement, and so there's interest in moving traffic enforcement out of the streets department. And so people to be able to respond to, let's say, a stranded motorist or a person who's had a car accident from a more medical perspective, as well as, what kind of support do you need for your vehicle? That's something that people want. Okay, thank you all to here's a question. Thank you all to the speakers and me for being such an energetic host. Question about the recommendations in the report about consolidating 911 call centers. How does that process happen, and has it been done before in the St. Louis region? That's a great question. I don't know the answer to that question, Christian. I think it's very important that when you don't know the answer to the question, you say that honestly. And so I'm going to find that out for you. I'm going to write it down. I'm sure one of my colleagues is also writing it down, but I'm going to write it down here so you know I'm doing it. Consolidate. I'm sure there's a way to like download this Q&A afterwards, but there's a part of my mind that's like, well, what if it gets lost? Consolidate 911 call centers.
Hey, Gia.
Yes.
This is Brian. I'm still on.
Brian, hello. Do you have an answer for this?
I do. So consolidating 911 centers does happen. Does happen in different ways. So you can virtually consolidate 911 centers, and you can physically consolidate them. By virtually consolidating, you save money by not having the same backroom equipment in every single 911 center. Therefore, you're not spending $100,000 on the black box with the blinking lights in the back room on a PSAP that's 5 or 6 miles away from another PSAP. Another way to do that is through brick and mortar consolidation, which means one PSAP absorbs another and does all the dispatching functions and call taking functions for that PSAP in a particular area. And I think the last part of that question was, has it been done in the St. Louis region?
Yeah.
It has, and it's ongoing. So there are PSAPs that we get reported that are no longer exist, and because they've been absorbed by a neighboring 911 center, or that entity that was running that 911 center, that PSAP, has turned over their responsibilities, and they're paying for the dispatching and answering of 911 calls to another service, basically. So that does happen, and it has happened at the very least 2 times in the 3 years that I've been working for the 911 service board. So
Brian, I feel like you're this like 911 angel. I was like, I didn't even know someone could help me, like call a friend. Brian, would you be able to speak to the outcome of consolidating those 911 centers, like PSAPs? Is it kind of positive? How does that go? We
see a fair amount of positive things that come out of it. So it's not for every location. Basically, we, from the 911 service board perspective, we're there to assist if need be. What we do encourage folks to do is virtually consolidate at the very least. That way you're saving dollars that could be spent on increasing salaries or anything else like that for the services. Plus you're saving taxpayer dollars, which is an excellent thing in providing the same service. But beyond the virtual consolidation, which has some benefits related to sharing staff, sharing capabilities, that sort of thing. A good example would be, I think Erricka mentioned that there was like 2 dispatchers on in St. Louis City at certain times. So if you virtually consolidate and you're basically sharing a call handling system and a CAD system between that entity and another entity, if calls start to roll over in a particular center, they could roll over to your virtually consolidated center and they answer your 911 calls and then send them back to you for dispatch, or potentially they have the ability to dispatch for you if you're unable to do it if there was some sort of disaster. So it can be beneficial on multiple fronts. It's just a matter of what kind of will and effort there is in a local environment. So a lot of times it comes down to some political discussions you might have, because there's some people that have questions about how that works. But for the most part, particularly the virtual consolidations can be very, very beneficial for both.
Nice. Thank you so much, Brian, for that answer. For those of you who don't know what a CAD system is, it's like computer aided design. And so that's basically the software system that dispatchers would use to code things in terms of like the calls coming in, correct, Brian?
The correct that's the function of it, but it's actually it's computer aided dispatch is what
Dispatch, thank you. Okay,
Yeah,
computer aided
CAD
design is
known,
something
yeah.
different. If you want to build like a bicycle and make it look
Yeah, there you go.
awesome, use CAD. But then if
Yeah.
you want to dispatch, if you want to code your calls, use the other CAD, computer aided dispatch. All
Yeah.
right. I love it. I really love that everyone's like gently holding me accountable to having correct answers. Christian says, thank you, Brian, for your insight, and Jaliam for your honesty. You're welcome. I will always tell you when I don't know stuff. I'm happy to do that for you. So I guess I want to just go into a little bit more detail with these top recommendations since it's 7:40. So as far as seating 911 within the public safety department, for the folks who wrote the recommendations, specifically the data and research team, as well as the editors who looked it over, also evidence based according to the research that we did prior, it is to conceptually and operationally communicate 911's role, not as an instrument of policing, enforcement, and control, but as a means of ensuring safety, support, and care. The other part around classifying dispatchers as first responders, we talked about the fact that dispatchers are currently classified as administrative workers. So like I mentioned, it's different levels of liability protection. Yes, Brian, thank you.
Sorry, I was just going to mention, I know you mentioned earlier, I didn't want to interrupt you, but
no, you're good.
On the governor's desk right now are some bills that will classify all telecommunicators, call takers, and dispatchers in the state of Missouri as first responders.
Woo! We love that. Yay. Okay, so it's on the governor's desk. If you care about it, harass the governor. I mean, not harass, reach out to and make your voice heard as a citizen.
Yeah, so the legislature's passed it. He's expected to sign it, so I don't know if definitely wouldn't harass, but if you want to show support, definitely do that. But we expect it to be signed, basically. So
yeah, wonderful. I appreciate that. And that's said in a joking manner. It all depends on the things that we're advocating for. But overall, yes, advocate, reach out, make your voice heard. Very important. And thank you so much for that update, Brian. So moving on to the dispatchers as first responders, just to kind of reiterate, it would make a difference as far as liability protections, prestige, and pay. And one of the notes that we make is that 911 is essentially the front door through which many people encounter police and the carceral system. And so any inequities, injustices, and inefficiencies basically compound the shortfalls and dangers of our current justice system. We want to maybe wrap and get to what's coming next. So I want to encourage you to think about transforming 911 as a racial equity matter and a public health issue. And here's a quote from Dr. LJ Punch, who is a trauma surgeon and founder of the TSTL, who does great work around trauma, kind of response, as well as prevention and bullet-related injury, recovering from that. He says fragmented systems are the antithesis of trauma care because trauma is injurious to trust. Any system of care that fragments itself from point of contact to delivery of service is not a good model. So this speaks to just overall all the different PSAPs that exist. What Brian mentioned as the reason, or not the reason, that like it came out of us or as a consequence of us being a home rule state. You know, for some people, that's something that's a positive. And what we're mentioning too is that it does add to the fragmentation of the system. It leads to inconsistencies with the type of care and response that you get. And it also makes it difficult to kind of make these large scale changes. And here's another quote: "Another world is not only possible, she is on her way. On a quiet day, I can hear her breathing," by Arundhati Roy. So these are things I'd love for you to take with you as you, you know, close out with this webinar tonight. My name again is Jalian Yang, she, they, Director of Storytelling and Communications at Forward Through Ferguson. Here's my email and my phone number, and you can reach out to me if you have any questions. What I am going to do is link in, let's see, can everyone see the chat? I think so, everyone. I'm going to link in the chat a link to transforming911.org, which should be easy enough to remember, but also a direct link to the report. So you can view it, as well as if you know anyone who needs to have a printed report because of access reasons, or they just love something physical in their hand, we have a survey or a form that you can use to request the report. That form is an interest form. It helps us know how many copies to order and where to distribute it. We will prioritize distributing it in places and to people and groups who are most impacted by racism, incarceration, and the public safety system. And at the same time, if you're willing to offset some of the printing costs, every report costs $15 to print and produce alone, not counting the data and research and design and copy editing, et cetera, and photo stories. But if you're willing to pay that $15, that can help us out just to make sure that it's not so expensive to give these away. But we have ordered, out of transparency, 300 copies, and I'm very excited for them, and I'm excited to get them into hands. But again, the digital copy is there, and thank you so much for spending your night with me. It is 7:46, so I am gonna release you all. Thank you again, Brian, 911 Angel, and thank you all, everyone, all of the 16 people who are still here with me. This webinar again is recorded, so I will be sure to share that later. Have a great night, everyone. Bye.